You have just read one of the descriptions of a term called invisible illness. It's a term I know well. In fact, I've had it all my life. I just didn't find out that it was called something until a few years ago. You see, when I was born, I weighed 4 pounds, 12 ounces, and had a double ear infection, which the doctors had not seen before, and I guess they didn't have any protocol for it, but they must have done something. Nobody told me what it was. I had to remain in the hospital until I broke the 5-pound mark. Some kind of rule, I guess. Can't let a baby leave until they're 5 pounds. My dad would come to try and feed me. Every day he would come to try and feed me. In addition, of course, to the nurses who were probably trying to do the same thing 24/7. And my father loved to tell me about that time because he said it attributed to my stubbornness, that I was far more interested in sleeping than eating. And as he held this 17-inch little creature that kind of looked like a plucked pigeon, he would constantly tap the bottoms of my feet to keep me awake enough to try and feed me. And he would be thrilled if he could get half an ounce of formula into me. And he knew that it was over when I decided that was it. I wasn't going to do it anymore. When I would lock my jaw shut and stick out my bottom lip, which meant, "You're done, son. I'm not drinking anymore. I don't want it." When I was 2 months old, after several nights of me screaming in my sleep, and my parents couldn't wake me up, they took me to the doctor, and the doctor diagnosed me with, I won't go into the clinical term for it, you can look it up, but he diagnosed me with night terrors. And my father's immediate response was, "She's 2 months old, what can she have nightmares about?" And the doctor explained to him, though they didn't really know very much at the time, they don't know very much now either, but that night terrors were completely different from nightmares, and you can't wake up someone who is having a night terror. They could scream, they can move, but something has to wake them up. They have to wake themselves up. You can't get them out. It's like imagine the worst nightmare you've ever had, multiply it by 10, then get trapped in it. Now, the interesting thing with night terrors is that apparently it's common in children, usually not infants, and the prevailing idea is that you grow out of it. I'm 38 years old. I still have them. I haven't grown out of them. And unlike nightmares, usually you don't remember your night terrors. You just wake up terrified and usually covered in sweat and sometimes vomit. In my case, I would say I remember maybe 5% of my night terrors, which of course is where I get ideas for my books. So I've taken what clearly is a curse as far as I'm concerned and tried to turn it to my advantage. That was life by 2 months old. By 6 months old, I had to have my first surgery, which was having tubes put in my ears. Because apparently I have teeny tiny little ear canals. I was always getting ear infections. And the story goes with that was that they gave me my little lullaby shot, and I went, no. So they had to give me another one, and then they put the tubes in my ears. I think now I just wanted the extra drugs. I don't know. To this day, I still get chronic ear infections. Before I was a year old, when I was about 7 or 8 months old, I had to wear leg braces. Now, imagine the leg braces in Forrest Gump, right? Except that my leg braces were attached to shoes, and the shoes had a bar between them. What it was is that from my hips to my feet were turned inward. And so I had to wear this, I think, 12 hours a day. And, think about it. Think about having to be like this. You can't see my legs. But legs straight out, feet like that for 12 hours a day. There was no crawling for 6-month-old Jane because you couldn't do it. From hips to shoes. This is not. And my lovely brothers would love to stand me up on the couch just to watch me fall over. So that was sweet. By the time I was a year old, I had had pneumonia several times, bronchitis. By the time I was 5, I'd had another ear tube, more chronic bronchitis, more pneumonia, and something that my mother was never able to remember the name of, but we lived like 15 minutes from the hospital, okay? And I would get this raging fever, and these red welts would just show up all over my body, like I had literally been beaten by 20 people with belts. So they rushed me to the hospital, and they would give me a shot, and the welts would go away, and the fever would go down, and they'd take me home, and 4 hours later it would all happen again. They took me back to the hospital. This happened like 3 or 4 times. I always said, why didn't you just leave me in the hospital? But there were a lot of questions that I asked my parents and never really got answers from. This is pretty much setting up my entire life. As far as the psychological issues, they were evident from the time I was 4. By the time I was 12, I was getting frequent migraines. I had just become a woman, which meant cramps so bad I couldn't move, migraines, throwing up. We never found out why. All of a sudden I started having nosebleeds. Like really, not just, oh, your nose is bleeding. I mean like nosebleeds. In the town I went to school in, had 5 churches and 1 stoplight. It, of course, went around the whole school that I was having nosebleeds because I was a cocaine addict. At 12. In the sticks. I don't know where I would have even gotten any cocaine from. But, that's how it started. Well, that year was also the year I began to cut myself. Now, at 38, some of the things that I have, some of the things I don't have a gallbladder anymore, and I don't have a uterus, fallopian tubes, or ovaries. I also don't have my wisdom teeth, but I think that's pretty common. I do have night terrors, TMJ, chronic pain, chronic fatigue, still get chronic bronchitis, I have no idea why, chronic gastritis, chronic gastroenteritis, chronic migraines, insomnia, delta deprivation, sleep disorder, which means that I don't go into the deep sleep that everybody needs. I am FUBAR completely. But do I look like it? I take daily prescription medications. Wait, I gotta count. I might just edit this to the number. Um, uh, 11 prescriptions that I take every day. On top of that, allopathic medications, herbal medications, is melatonin, magnesium, acid reflux medication, which if I don't take, oh God, it's horrible. Ginger root. I'm trying a new migraine preventative, which we won't know if it helps until this migraine goes away. So the 7 supplement, non-prescription medications that I take every day. In spite of that, I'm sick every single day of my life. Every single day. It's not a matter of if, it's a matter of how bad. I know the scale of 1 to 10 very, very well. On my best days, I'm a 5. As long as I'm a 7 or below, I can sort of function. Obviously, I'm not very social. I can't be. I never know when I'm just gonna be in so much pain that I can't move, and I certainly don't want to throw up on anybody because that's not fun. My main symptoms, the cause is still not known. I've been to neurologists, several, gastroenterologists, several. I've been to osteopaths. I've been to headache specialists. I've been to ENT. I mean, pretty much you, endocrinologist, hematologist, you name the specialist, and I've been there. I think I might get further. I could get further in my medical diagnosis if I could lock all of these specialists in a room with my files and force them to talk to each other about it. But that's never going to happen. And why am I telling you all of this? This is my abbreviated history of invisible illness. Not only do I have to deal with the physical health aspects of it, being this ill really fucks up your head. So I'm constantly dealing with depression, with hopelessness, with helplessness, with a lot of things. And I cope very well, thank you very much. Some days are harder than others. And I'm saying all of this because it really, really hurts when someone says, "Oh, you look fine, you don't look sick," because it makes you feel like they're telling you you're a liar. Of course, if the hypochondria word ever comes up, I just want to punch them in the face. I can't though, because I hurt and I can't physically do it. And then they're the ones of, "Oh, you're sick again? You were just sick." That's what chronic means. Millions of people deal with invisible illness. And some of them actually have diagnoses, have names. Lupus. Several types of cancer. Chronic fatigue. The list goes on and on. But you know what? Most of the time you don't see it. They don't look sick. And since they don't look sick, people don't believe us. They don't relate to us. I had family members who believed that I was making it up until they had to spend more than 2 or 3 days with me and saw it with their own eyes. For some reason, it might be related to a genetic blood disorder that my father had. When my migraines get really, really bad, my eyes get really, really bruised. My whole face, actually, it looks like somebody beat the shit out of me. And my wonderful husband is like, okay, you're in a lot of pain. We're going to urgent care. And I'm like, not with a face like this, because they're going to believe you beat the crap out of me and you didn't, and we can't prove that you didn't. And so, no. So a lot of times I probably should go to ER or urgent care, and I don't. Because it's the one time when I actually do look like something's wrong, but I don't look like I'm sick. I look like I've been beat. This is my rambling introduction to a series I am going to do about invisible illness. I am talking to other people who deal with it. And I'll probably talk more about my own. So, my email is in the description. If you are willing to talk to me, to have me interview you, and you suffer from an invisible illness, please email me, and we will arrange either through Skype or some kind of video chat, because more people need to know about this. And more people need to understand that sometimes the book cover is really pretty, but there's an unbelievable horror story inside. So take care of yourself and be kind and compassionate, because you never know who's suffering. Thank you.